Hypertension Awareness Series Episode 14. Good morning. If you are diagnosed with hypertension, what tests or investigations must be done? A diagnosis of hypertension is not the end of the conversation. It is the beginning of a deeper evaluation because high blood pressure is not just a number. It affects organs silently long before the symptoms appear. When someone is newly diagnosed with hypertension, the most important question is, has the blood pressure affected any other organs? Are there also other additional cardiovascular risk factors hiding beneath the surface? We have learned that hypertension affects other organs. We don't just treat the BP numbers, we assess the whole cardiovascular landscape. These investigations are very important and they help us, one, to detect target organ damage, to identify reversible causes of hypertension. They help us stratify your cardiovascular risk and guide the treatment intensity. Not all BP numbers are equal. So what are these baseline tests that every newly diagnosed hypertensive patient should have? Number one, kidney function tests. Hypertension and the kidney are closely linked. The baseline labs should include serum creatinine and urea, estimated glomerular filtration rate, the EGFR, the electrolytes, especially potassium and sodium. This matters because it helps us detect hypertensive kidney disease, all kidneys as a secondary cause of hypertension, and guide safe choice of medication. Kidneys can be a complication of hypertension and it can also be a cause of hypertension. Test number 2 is urinalysis and urine albumin. These are simple urine tests that can detect early kidney damage. A urine dipstick that is available even in the health centers. The urine albumin creatinine ratio or UACR can also be done. Even small amounts of protein in urine increase your cardiovascular risk. What we call microalbuminuria is often the first silent warning of kidney damage. Number 3 is a fasting blood sugar, or you can also do the HbA1c. Hypertension and diabetes frequently travel together. So you need to screen because diabetes multiplies your cardiovascular risk. It influences our BP targets and it alters choice of medication. And if both are present, if you have both diabetes and hypertension, your risk triples. Test number 4 is a lipid profile. We do the total cholesterol, the LDL, HDL, and triglycerides. Hypertension plus high cholesterol leads to accelerated atherosclerosis. We don't treat BP in isolation. We treat plus the cardiovascular risk. Test number 5 is an electrocardiogram or an ECG. It helps screen the heart. We can see left ventricular hypertrophy, if you have had a silent heart attack, if you have any problems with arrhythmias, and long-standing hypertension causes strain on the heart. And ECG is the easiest screening test for the heart. Test number 6 is an echocardiogram when indicated. It is not mandatory for everyone, but it should be done if you have long-standing hypertension, if your ECG is abnormal, if you have other symptoms of breathlessness, chest pain, if we suspect heart failure, we should do an echocardiogram. Echocardiogram shows us heart muscle thickness, how is the pumping function, how is the diastolic function, and any other structural abnormalities of the heart. So ECG and echo if indicated. Test number 7 is fundoscopy, your eye examination. The retina reflects the vascular health, and you're able to assess in a patient with hypertension, are you having any vascular damage? Remember, the eye is the only place we can directly assess the small blood vessels. So fundoscopy, mandatory for anyone diagnosed with hypertension. 8, and most important, screening for secondary causes when suspicious. Not all hypertension is essential. So investigate for secondary causes if there is onset before the age of 30, severe hypertension, resistant hypertension where you are using 3 or more medications, if you have low potassium, if you have kidney abnormalities on urinalysis. And some of the tests may include a renal ultrasound, aldosterone-renin ratio for primary hyperaldosteronism, a sleep study, your thyroid functions. Please note, If you suspect secondary causes, investigate for secondary causes. All these tests that we have mentioned are important because hypertension is not just about numbers. It's about the overall risk. If you treat hypertension and you missed high cholesterol, your patient will still come with a stroke. So once you are diagnosed with hypertension, we need to do those tests to assess the organ damage and to assess other hidden underlying cardiovascular risk factors. Once you get diagnosed with high blood pressure, get checked your kidney function, screening for diabetes, have your lipids assessed, have an ECG done, and have overall cardiovascular assessment done, because baseline evaluation determines treatment intensity. Don't be BP centric. Let's assess the overall cardiovascular landscape. Remember, with proper baseline evaluation, structured follow-up, and even appropriate medication, you can live your life fully with hypertension. So, if you have hypertension, have these baseline tests done. Your urea electrolyte and creatinine, your estimated GFR, your lipid profile, your fasting sugar or HbA1c, urinalysis plus urine albumin, fundoscopy and an ECG, and an echocardiogram if needed, and screening for secondary causes if there is reason. So let's discuss. If you have hypertension, which of these tests have been done? Do you know your kidney functions? Do you know your cholesterol numbers? You need to be proactive. Have the discussion with your doctor and to the healthcare providers. What tests are you doing in your patients once you diagnose hypertension? Let us not be BP centric, where we focus only on the numbers and forget the overall cardiovascular risk. I have said in that hypertensive patient, if they have high cholesterol and you're just treating the numbers, they'll still come with a stroke or a heart attack. Let's not be BP centric. Assess the overall cardiovascular risk. Assess the target organ damage. And for the patients, for those who have hypertension, have a discussion with your doctor. How is my kidney function? How are my cholesterols? How are my sugar levels? Take action. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.